Hello everyone, welcome to my channel. Today we are going to discuss about quadriplegia, also known as tetraplegia, from a physiotherapy rehabilitation perspective. So quadriplegia is not just a neurological diagnosis, it is a condition that affects every system of the body, including movement, respiration, circulation, and even psychological well-being. As physiotherapists, our role extends far beyond exercise. So we play a key role in survival, recovery, independence, and quality of life. So let us understand quadriplegia in a structured, clinical, and practical manner. Yeah, coming to the definition, that is nothing but quadriplegia refers to paralysis affecting all four limbs and the trunk, so resulting from spinal cord injury, that is lesion occurring between C1 and C8. The term quadriplegia and tetraplegia are often used interchangeably, so the extent of paralysis depends on the level of spinal cord injury, completeness of the lesion, associated secondary complications. Higher the level of injury, greater the functional loss, particularly respiratory involvement. So, coming to the Asia impairment scale. So the Asia Impairment Scale is the gold standard for neurological classification. So the first one is AIS-A, that is complete injury. So there will be no motor or sensory functions below the neurological level, whereas B is nothing but sensory is preserved, but whereas motor is absent. Whereas in condition C, motor is preserved, but muscle strength is below muscle power of 3, that is 3 by 5. Whereas in D, motor is preserved with strength greater than 3 by 5. Whereas in E, normal motor and sensory function is present. This classification is extremely important because it guides prognosis, helps set realistic physiotherapy goals, and determines rehabilitation potential also. Coming to the etiology, the causes of spinal cord injury. Major causes include RTA, falls, especially in elderly, sports injuries like diving, violences such as gunshot injuries is more common. So, non-traumatic causes include tumors, infections like transverse myelitis, degenerative cervical spine disorders, and congenital anomalies is also present. Understanding the cause helps us to anticipate complications and plan the rehabilitation. That's it. Yeah, coming to the pathophysiology, so the spinal cord injury occurs in two stages: immediate mechanical damage due to compression, contusion, or transection, whereas this causes irreversible neuronal losses. Whereas the secondary injury might be occurs over minutes to weeks, that is edema and ischemia, inflammatory responses, exitotoxicity, apoptosis of surrounding neurons. So this secondary injury expands the damage beyond the original site, which is why early physiotherapy intervention is very crucial in such conditions. Yeah, coming to the clinical features, quadriplegia affects multiple systems, as we all know. The first thing is motor, that is complete or partial paralysis of limbs will occur. Whereas the second thing is loss of trunk control. Whereas in sensory, loss of pain, temperature, and proprioception is present. Whereas in respiratory, that is most critical cases in some way. So diaphragmatic weakness or paralysis is present. Reduced vital capacity, ineffective cough is also present. High risk of pneumonia is present. Whereas in autonomic dysfunction, orthostatic hypotension, autonomic dysreflexia, bowel and bladder dysfunction is also present. And respiratory failure remains the leading cause of mortality, as we all know. Yeah, coming to the physiotherapy assessment, that is a comprehensive approach. So physiotherapy is a cornerstone of quadriplegia management. So our goal is to preserving life in acute phase, whereas preventing secondary complications and maximizing functional independence. And education to caregivers is also being given, in which the breathing exercise and effective coughing techniques will be teaching to the patient attender. Whereas a range of motion exercise, sitting, standing, that is functional mobility exercise, whereas which is given in a stage wise manner, is also being educated to the caregivers. Whereas the last thing is nothing but improving the quality of life. Quality of life is nothing but more and more important than any other thing in rehabilitation. So all these things has been educated to the caregivers. So it's nothing but acute phase, preserving life, preventing secondary complications, maximizing functional independence, educating caregivers, and improving quality of life. So with early intensive and individualized rehabilitation, patients can achieve meaningful independence.